Good evening, doctors. This is Dr. Sam from Sam Agency for OT Services. Today I'll talk about the listening and reading subtests. First of all, in our OT camp, we can provide OT preparation for medicine, dentistry, nursing, radiography, physiotherapy, and pharmacy virgins. First of all, the OT has 4 subtests or consists of 4 subtests. The first one is the listen subtest, then the reading subtest, the third one is writing subtest, and the last one is the speaking subtest. First of all, the listen subtest, it will last for approximately 45 minutes, and the content here is the same for all healthcare professions. Here you have to follow and understand a range of health-related spoken materials, such as patient consultations and lectures. The second one, reading subtest. This subtest will last up to 60 minutes. Here, the content also is the same for all healthcare professions. You have to read and understand different types of text on health-related subjects. The third subtest is the writing subtest, 45 minutes. It's specific to profession based on typical workplace situations. The task is to write a letter, usually a referral letter. Sometimes, especially for some professions, a different type of letter is required. For example, a letter of transfer or discharge, or a letter to advise or inform a patient, carer, or group. The last subtest we have is the speaking subtest, approximately 20 minutes. Also, it's specific to profession based on typical workplace situations. You will be in a private room and you will take part in 2 role plays. You take your professional role as a healthcare professional, while the OET interlocutor plays a patient or client, or sometimes a relative or carer. So this is the structure of the OET. Let's talk about the structure of the first subtest, which is the listening subtest. The listening subtest has 3 parts. The first one is the part A, then part B, then part C. In part A, you will have 2 consultation extracts, about 5 minutes each. Part A assesses your ability to identify specific information during a consultation. You will listen to 2 recorded health professional patient consultations, and you will complete the health professional's notes using the information you hear. And the sum of the questions here is 24 questions. In the second part, part B, you will have 6 short workplace extracts, about 1 minute each. Part B assesses your ability to identify the detailed guest opinion or purpose of short extracts from the healthcare workplace. You will listen to 6 recorded extracts, for example, team briefings, handovers, or health professional patient consultation dialogues, and you will answer 1 multiple choice question for each extract. So here we have 6 questions. The last part, part C, you will have 2 presentation extracts, about 5 minutes each. Part C assesses your ability to follow a recorded presentation or interview on a range of accessible healthcare topics. You will listen to 2 different extracts and you will answer 6 multiple choice questions for each extract. So here we have 12 questions, 6 questions for each extract, and we have 2 extracts, so we have 12 questions. The reading subtest structure, also this subtest has 3 parts, part A, part B, and part C. But the difference here, in this subtest, you'll set the first part, part A, separately in a different or in a separate setting within 15 minutes. And after that, they will collect the answer and question booklets Then you'll receive new booklets for part B and C together. While in the listening subtest, you'll set all the parts in a single setting. Part A, here we have an expeditious reading task. Reading task very fast, within 15 minutes. It assesses your ability to locate specific information from four short texts in a quick and efficient manner. The four short texts relate to a single healthcare topic, and you must answer 20 questions in 15 minutes. The 20 questions consist of matching, sentence completion, and short answer questions. After that, you'll receive new booklets for part B and C together, and you have to finish these two parts within 45 minutes. Part B assesses your ability to identify the detailed guest or main point of six short texts sourced from the healthcare workplace, and the word count here is about 100 or up to 150 words for each extract or each text. The text might consist of extracts from policy documents, hospital guidelines, manuals, or internal communications such as emails or memos. For each text, there is one three-option multiple choice question. So here we have three possible answers, while in part C we have four options for possible answers. So this is the difference between part B and part C. In part C, it assesses your ability to identify detailed meaning and opinion in two texts on topics of interest to healthcare professionals, and the word length here 800 words for each text. For each text, you must answer eight four-option multiple choice questions. Regarding the writing subtest letters, we have the first type, referral letter, the second one, discharge letter, the third one, the transfer, and the last one, update or information letter. Regarding these types, just as a brief discussion regarding each type, in the referral letter, you will have a patient and you are the GP who will transfer, who will refer this patient to a specialist. So this is the referral letter. A patient will be referred to a specialist. Discharge letter, after after managing the condition of the referred patient, this specialist will discharge the referred patient to his GP. So this is the discharge letter. Transfer letter, like the specialist might transfer the referred GP, the referred patient to another specialty. So this is the transfer letter. The last one, update or information letter, a doctor will inform another person, might be a GP or even the carer or nurse, etc., regarding certain points and instructions regarding the patient's condition. Regarding the writing subtest timing, at the start you'll receive two papers. The first one, writing task, and the second one, answer booklet. Within the first 5 minutes, you are allowed to read only the reading task. So don't use your pencil within the first 5 minutes. You will read only this writing task, and in the next 40 minutes, you are allowed to use your pencil. You can cancel the irrelevant case notes or highlight important notes or even write down brief notes on the writing task. Then you can start writing the letter format firstly, then the introduction and body paragraphs, then the conclusion for the requested letter. Then this is the end of the writing timing. Regarding the speaking subtest, you will have in the first 2 up to 3 minutes, here we have warm-up questions. And here we have no marks because we have, yeah, you will not be penalized uh, on your mistakes. So that's why here we have no marks. At the start, you will receive the first card. So this is the figure or a sample of a card you will receive. This is your profession, like a doctor, medicine, and this is the number of your card, and this is the card for the OET intellector, the person who will play the next role. At the start, you will have 3 minutes for preparation. You have to prepare this card within the first 3 minutes, and after that, the exam will start. The OET intellector will start recording the next 5 minutes for conversation. Then you'll receive the next card, roleplay card number 2. And again, here we have 3 minutes for preparation and 5 minutes for conversation. And then this is the end of your exam. So let's start with the first subtest, the listening subtest. Regarding listening frequent asked questions, how is the listening test scored? The full mark is 500 points over 42 questions. So the weight of points for each question is about 12 points. You have to answer at least 30 questions correct to get B score, 350 and above, grade B. The main accents, we have Australian, British, American, and other varieties such as New Zealand, Irish, Canadian, and South African. Where do I write my answers for the listening subtests? For part A, in the space provided, while for part B and C, shade the lozenge or shade the circle beside the correct answer. Do I need to write down exactly what I hear? Actually, you have to write the same words you hear. You should not paraphrase the information because this might affect the meaning of the correct answer. So that's why you have to write down the same words in the listening subtest. You can use abbreviations that are commonly accepted in your profession and which are clear to other professionals. You will lose marks if you contradict yourself or make your meaning unclear. So that's why you should not paraphrase the information. So please write down the same words you hear. Lastly, you will not be penalized for misspellings because this exam is the listening subtest or listening exam, not the writing subtest or writing exam. Any reasonable attempt at spelling the correct answer has a good chance of being accepted. Regarding the points weights for each part, here we have in part A, we have 57% of points for this part. And for part B, we have 40% of marks or points for this part. And lastly, for part C, we have 29%. Regarding the listening subtest, this is a sample of the listening subtest. In the first paper, you will find your data like the candidate number, last name, first name, middle names, profession, venue, and test date. Then you have to write down here your name like a signature or sign off. Here we have general structures. Then the first part, part A, here we have 24 questions for two extracts. So each extract has 12 questions. This is the first extract, extract number one, questions 1 to 12. We have 12 questions for the first extract. Then this is the second extract, questions from 13 to 24. Then this is the end of the first part. Then you will move to part B. In part B, we have 6 questions from 25 to 30, multiple choice questions. The first one, the second one, third one, fourth one, fifth one, and the last one. Then we'll move on to the last part, part C. Also, we have multiple choice questions. You have 12 questions. For extract number one, 6 questions, and for extract number two, also 6 questions from 37 to 42. So the sum of the questions in this part of this subtest, 42 questions, and you have to get at least 30 correct answers. While for the reading subtest, also for the first paper, the same thing. Then we have part A, 4 short texts. Text A, text B, then text C, then text D. And you'll have another booklet, answer booklet, or the papers for questions and answers. So we have the first 7 questions matching. Then we have the next questions from 8 to 14, like short answers, and from 15 to 20, sentence completion. So this is the end of the first part, the reading subtest, part A. Then they will collect the booklets for questions and answers, and you'll receive the next booklet for part B and C together. Also, for the first papers, it is the same thing. You'll have your data. Then part B, we have 6 short texts. For each text, you have the multiple choice question consists of 3 possible answers. This is the second one. This is the third one, fourth one, fifth one, and this is the last one, number 6. Then part C, we have 2 large texts. Each text consists of up to 800 words. And we have 7 to 8 questions, multiple choice questions for each text. This is the text number 2. And here we have the questions. So this is regarding the samples for listening and reading subtests. Regarding time management for part A in the listening subtests. For part A, here we have this introduction, like question English test, listening test. This test has 3 parts. In each part, you will have, or you will hear a number of different extracts. At the start of each extract, you will hear this sound. Then you will have this time gap. And after that, the record will start for the first extract for the first question till the end, the question number 12. So how do I manage my time in part A in the listening subtest? Actually, here we have um, 110 seconds, like a time gap between the introduction and the start of hearing the record for the first extract or for the first question till the end. So let's hear this sample.
Occupational English test. Sample test 1. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
So as you see, the timer is still
Extract
running.
1, questions 1 to 12. You hear a physiotherapist talking to a new patient called Ray Sands. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So the time is still running.
Come in. It's Mr. Sands.
So as you see, here you have this time gap, and in the record you are informed to have 30 seconds only, but actually you have 110 seconds instead of 30 seconds. So that's why you have to ignore the first record for this introduction and the general instructions. So instead of hearing this record, you have to start preparing the first question till the end. Once you hear the record regarding the first question, here you can follow and listen carefully for the record. But before that, please ignore the record. So that's how to manage your time in the listening subtest. In the first part, between the introduction and extract number 1. Regarding part A, tips and methods, or how to deal with these questions in part A. At the start, you have to read and underline the main items and indicators, like important words and keywords or important information. So you have to read and underline these words. Then you have to read and predict the correct answer or the correct word. Might be a noun or a verb or adjective. Then read and outline the general idea. So here we have this mind mapping for each question. At the end, try to prepare as much as you can the next extract number 2, because in the time management or the time gap between the first extract and the second extract, here we have 30 seconds only, while between the introduction and the first extract we have 110 seconds. So that's why try to prepare the second extract in the time gap for the first extract. Then follow the record and hit your answers. So this is the sample for part A. And as you see here, at the start, we have patient's name, Ray Sands, and here we have this main item. 18 months ago, then 1 year ago, then 6 months ago, then last month. Past, like past medical history. Here we have back injury. Sustained could be caused of or by something, lifting something. So lifting, noun. Then briefly underline these main items and important words just to follow the record. They will help you to follow the record. Then in the next main item, patient's description for symptoms. So here we have symptoms. Pain located in which part of the body? Then pain described as maybe adjective. Loss of mobility, problems sleeping, then mentions inability to do something. Then here we have sensation in calves. Might be an adjective for this sensation. A word describes this noun, maybe an adjective. Then this is the second or the third main item, occupation. So this is the space for the occupation of this patient and involves travel and some manual work. So what's the type or what's his occupation? Initial treatment prescribed non-steroidal. Application of something provided some relief, so it will be a medication. Then referrals to maybe another specialty or a doctor. Here we have sports injury specialist for rehabilitation and exercise program. Then further treatment for the treatment, further treatment, because we have initial treatment, then further treatment, epidural injections, and we have another line of treatment. Then electric impulses, then decided not to try something. Patient attributes recovery to certain medication. Then previous diagnosis, sciatica probably related to, so this is the cause of sciatica. So this is how to predict the correct words, maybe a verb or a word, a noun, or an adjective. And here we have the next extract number 2, questions from 13 till the end 24. So you have these spaces and you have to prepare this extract is the same way for the previous one. You have to underline the main items and important words and keywords or important information. Then you have to predict the correct word. For part B, so this is the sample for part B for the listening subtest, 6 MCQs. And here we have time gap between the introduction and the first question. Then we have another gap between the first question and the next one. Then another time gap between this question and the next one. Also a time gap between this question then the next one, and so on till the end. So in part B, we have time gaps between the introduction and the first question and between each two questions. While in part C, you will have time gap between the introduction and the start of the record for the whole 6 questions. Because in part C, not B. In part C, you will have one time gap between the introduction and the start of the record for the whole questions. Because in part C, you will hear the record for all these questions once without pauses or gaps. While in part B, we have time gaps for each question. Part B, question structure. Firstly, we have the context, like you hear a nurse briefing her colleague about a patient. So this is information regarding the setting related to this question. Then question prompt. For example, what does she warn her colleague about? And we have a question mark. So this is the direct question and complete question. Question prompt. The type of this question prompt, direct question prompt or complete question prompt, because we have this question mark. Or we have another type of question prompts. We have incomplete sentence without a question mark. Like he says that errors in dispensing medication to patients usually results from blah blah blah. So here we have the indirect question prompt. Regarding the answers, we have short answers and long answers. For example, the patient is allergic to penicillin. Here we have short answer, and for this one, oxygen may be needed if the patient becomes breathless. Long answer. So this is the structure of questions in part B. Then time management for part B. Again, here we have this introduction and the first question in part B, question number 25. And as I told you in the previous slide, here we have a time gap between the introduction and the first question. Then we have time gaps between each two questions till the end of this part. Here we have 55 seconds between the introduction and the first question.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
So this is the real time gap, 30 seconds from here till the end.
Mrs. Gray.
So again, please ignore the record for the introduction. Go directly to prepare your questions and start following the record once you hear the record regarding each question, not for the introduction and general instructions. Again, here we have another time gap between each two questions, question and question. So this is the first question in part B, and this is the second question, question number 26. Then we have 26 and 27, then 27, 28, then 28 and 29, then 29 with 30, which is the last question. Between each two questions, we have also time gap of 30 seconds.
Hour.
Okay. Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the...
So this is regarding time management for part B. So how to deal with questions in part B. Firstly, you have to read the context. You hear a nurse briefing her colleague about a patient. Then read the question prompt and answers twice. What does she warn her colleague about? And read the given answers twice. And try to locate the aim or the purpose of the question prompt and the alarming words or important information in each given answer. Like the patient is allergic to some types of antibiotic, so the patient is allergic. Care must be taken to prevent the patient from falling. Care to prevent the patient from falling. Then oxygen may be needed if the patient becomes breathless. Oxygen for breathless. After underlying the important words and remind yourself for the question prompt, start ignoring reading the answers and start to listen carefully. Then repeat the prompt in your mind. Repeat the prompt in your mind and detect the correct answer. So again, the sequence to deal with such questions in part B: read briefly the context just to know the setting, then read and underline the question prompt and the given answers and locate the main idea, important words, keywords, important information in the given answers. After reading these points twice, ignore the answers. Don't read again the answers while listening. Just remind yourself about the prompt. This is the prompt. Remind yourself regarding the prompt. While listening, you can locate the correct answer, but please don't read the answers while listening because you will find each word in these given answers in the record you'll listen, but with different meanings. So that's why you have to follow the record without reading the answers. So let's take this example and please try to practice with this sequence.
Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness, and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable. Oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain with good results. She has an 18 gauge in her left arm.
Yep.
She's got normal saline at 15 mils per hour.
Okay.
So could you tell me what's the correct answer, please, for this question?
B.
You can write down your answer in the chat, please. Excellent. Yes, the correct answer is B. Care must be taken to prevent the patient from falling. So let's go for the next question. But before that, yes, we have this slide. The provided answers could be a correct answer, or a contradicting answer, or not mentioned at all, or mentioned but the meaning is too specific or too generalized. You have to locate this one, correct answer. So please exclude the contradicting answer, exclude the answer which has information not mentioned at all, or mentioned but not fitting the correct answer. The meaning is too specific or too generalized. So here we have these distractors, while this one is the correct answer. So that's why you have to locate the distractors and exclude them. So let's practice.
You hear part of a morning briefing on a hospital ward. Now read the question.
Right, so overnight admissions to the ward. Greg, could you start us off?
Sure. We have Sue Deans in bed 5. She's a 54-year-old female who was brought into the emergency department by police overnight. She has a history of poorly controlled paranoid schizophrenia. She presents with chronic persecutory and paranoid delusions and also significant thought disorder. She's to remain in high dependency unit care until the stabilization of her symptoms. We'll be observing her every 15 minutes and monitoring the level of her distress, psychosis, and any response to interventions offered.
Okay, I'll review the clinical and detention status this afternoon. Now, what's the plan for discharge?
Social work interventions required for placement and community support options, and that's been booked for tomorrow. Also, an application for the appointment of legal guardian may be required.
Right. We'll consider that at tomorrow's ward round.
So as you see in this context, you hear part of a morning briefing on a hospital ward, and the question prompt, we have this two important word, today. What's the plan for the patient today, not for discharge, because discharge would be tomorrow, while the question prompt is what's the plan for the patient today. Yes, excellent. The correct answer is A. Her emotional state will be carefully observed. The next one.
You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anesthetist. Just pethidine or gas and air, but they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
So, doctors, what's the correct answer? Obviously, the patient asked about at-home epidural, then the GP instructed her or advised her regarding the pethidine. So, what painkillers might be available during labor? Okay, Dr. Ala, you have to review the correct answer so you can hear it again.
You hear part of an antenatal consultation at a GP practice. Now read the question.
Mrs. Summer, how can I help today?
Well, I just wanted to check something.
Okay. So you're having a home birth?
Yeah, though everyone's on at me about going into hospital. I had my last child there, but I'm determined to be at home this time, to feel more relaxed as well as safe. But I wondered about an at-home epidural if I wanted it. Going without wouldn't put me off, though.
An epidural's out, I'm afraid, because we can't do it without an anesthetist. Just pethidine or gas and air, but they're very effective painkillers.
Yeah, pethadine's good.
And you had a bad patch after giving birth last time.
Yeah, I got really depressed. I couldn't understand it. It was short-lived, though, and I'm better prepared now. It can't be prevented, but I have read up about coping strategies.
Okay, the next one.
You hear a trainee doctor telling his supervisor about a problem he had carrying out a procedure. Now read the question.
So how
Sorry, first.
You hear
so how's today gone, Harry?
Well, I'm afraid I had a problem taking blood from Mrs. Harris. I've done that procedure numerous times now, so I wasn't particularly worried. What I hadn't anticipated was the difficulty finding a vein. I suspect her illness means she'll have had a number of cannulas inserted over the weeks she's been here, and that's led to collapsed veins.
Well, that can happen with long-term elderly patients, and it's distressing for them if the procedure isn't done quickly.
Oh, I mean, she endured it without a murmur.
Hmm.
I'm sure I would have made a fuss in similar circumstances.
Well, I'll supervise you the next time you do it.
So, what's the correct answer? Yes, the patient had many cannulas in her veins, and that's why her veins tend to be collapsed. treatment administered previously. Treatment administered previously, yes. Who's got 3 correct answers? Okay. Here we have part C. This is a sample for part C. This is the introduction, and we have the questions in the first extract. The time gap will be between the introduction and the start of the record for the whole upcoming 6 questions. So that's why please ignore the record for the introduction and go directly to prepare these 6 questions without pauses or without gaps.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1, questions 31 to 36. You hear an interview with a cardiologist called Dr. Jack Robson, who's an expert on Chagas disease. You now have 90 seconds to read questions 31 to 36.
So we have the real gap, 90 seconds from the end of the record of this previous introduction, then the start of the record for the first question. So this is the real gap. Right? Instead of waiting to start the real gap, we can ignore the record for the previous part and start preparing directly these questions without hearing or following the previous record. So this is how to manage your time in the listening subtest for part A, part B, and part C. So this is the management for time gap, introduction and instructions, and the first question, and we have no gaps between each 2 questions. So that's why we have one time gap between the introduction and the start of the record for the first question till the end. We have about 2 minutes, and for time management between each 2 questions, unfortunately, we have no time gap. No time is allowed between each 2 questions. For part C, tips and methods, or how to deal with these types of questions in this part. Again, we have the question prompt. You have to read firstly the question prompt. Like Dr. Robson says that concerns over Chagas in the USA are results of. Then we have the given answers. We have important information or keywords like a rise in the number of people at risk of being infected with the disease, number of people at risk, greater awareness of how many people there have the disease, greater awareness, people have the disease, then increased prevalence of the insect which carries the disease, increased prevalence of the insect which carries the disease. So you have to underline the main idea in the question prompt and indicators or important information or keywords in the given answers, then this is the most challenging step. Here you have to listen, read, and listen. Firstly, remind yourself regarding the question prompt. Please don't read the question prompt while listening. So you have to save this in your mind. And while listening for the record, you have to read the given answers. And at the same time, again, you have to listen to the record. So that's why it's very challenging. It's very hard. You have to listen for the record, to the record, and read the questions and listen the record and read the questions and listen the record and read the questions and so on till to locate the correct answer. Like swinging. So remember the question prompt, read the answers and listen. Then read the answers and listen. Then read the answers and listen. Then exclude the distractors and locate the correct answer. So this is how to deal with this type of questions in part C. So again, read the question prompt briefly and remind yourself about the given idea. So you have to locate the requested or the intended meaning for this question prompt and locate the important information or keywords in the given answers. Then start listening. While listening, you have to read the question, the given answers, and go again for listening, and so on. Again, the provided answers could be a correct answer, a contradicting answer, not mentioned at all, or mentioned but the meaning is too specific or too generalized. We have to exclude all these types of answers and you have to detect the correct answer only. So this is a sample for a question in part C. So at the start, you'll listen to this record and try to detect the correct answer. And after that, you will listen again to the record and you can read the transcript for this record to help you to detect the correct answer. So let's hear the first turn.
Right, I see. And are there any concerns in the USA about shell gas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the...
So could you tell us the correct answer? Okay, so let's hear again the record while reading the transcript.
Right, I see. And are there any concerns in the USA about shell gas?
Yes, the insect carrying the parasite is actually endemic to the southern U.S. states. Since 1955, however, no more than 30 people have been bitten and infected while in the USA. The alarming thing, though, is that it's become apparent that large numbers of first-generation and some second-generation immigrants from Latin America carry Chagas, around 300,000.
Right.
These people won't infect others, apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill.
And for the
Okay. So in brief, as you see here in this transcript, you have this first part, then this second part, then this last part. In the first part, yes, the insect carrying the parasite is actually endemic to the southern US states since this date. However, no more than 30 people have been bitten and infected by in the USA. So let's compare the given information with each given answer. For the first answer, a rise in the number of people at risk of being infected with the disease. Actually, it's contradicting the information given here. While a greater awareness of how many people there have the disease, not mentioned at all. An increased prevalence of the insect which carries the disease, also not mentioned at all. So, contradicting answer, not mentioned, not mentioned. For the second part, the alarming thing, though, is that it's become apparent that large numbers of first generation and some second generation immigrants from Latin America carries Chagas around this number. The alarming thing concerns. Dr. Robson says that concerns over Chagas in the USA are the result of the alarming thing. It's a paraphrasing for concerns. It's that become apparent that large numbers of first generation and some second generation immigrants till the end. A rise in the number of people at risk of being infected with the disease, not mentioned at all. A greater awareness of how many people there have the disease. Here we have a great awareness is that it's become apparent that large numbers of the first generation and second generation. So here we have a paraphrasing for the given information in this part and with the information given in this answer. An increased prevalence of the insect which carries the disease, not mentioned at all. For the first part, these people won't infect others apart from congenitally and possibly through blood transfusion, but a significant proportion end up chronically ill, like modes of transmission. For the first given answer, not mentioned at all, also not mentioned at all, and increased prevalence, also not mentioned at all. So the correct answer is B. The alarming thing concerns is that it's become apparent that large numbers of first generation, how many people there have the disease. First generation, some second generation, and immigrants from Latin America carries Chagas around 300,000. So how many people there have the disease? This number, and this is the concern, and it's here we have greater awareness for this number. So this is the correct answer. Yes. So this is how to deal with these parts in the listening subtest. You can practice the listening subtest at our website, samagency.net. You can practice these auto-corrected OT facial sample or samples, the first sample and the second sample, and also we have other exams, about 4 or 5 pre-prepared exams, and we are working on the rest. For the next part or the next subtest, the reading subtest. The reading subtest structure, as we have discussed in previous slide, part A and part B and C. In part A, you'll set this part in a different or in a separate setting within 15 minutes, while for part B and C, you have to set these parts within 45 minutes together. Question types in part A, we have matching questions from 1 to 7 and short answers questions from 8 to 14 and sentence completion questions from 15 to 20. The sequence for answering these questions is start from question number 8 till the end, then go back from the start till the 7th question. Because instead of searching for the each paragraph for the given information, you can start answering these questions, and after finishing answering these questions, you'll be able to locate for each extract or each paragraph and the matched information which mentioned or which will be mentioned in each paragraph. Like we can take a sample for this type of questions. Questions from 1 to 7. For each question, 1 to 7, decide which text A, B, C, D the information comes from. You may use any letter more than once. In which text can you find information about procedures for delivering pain relief? So instead of searching for this information and in which text, you can go for these questions and start answering these questions, then go back, and it will be easy to detect which text mentioned procedures for delivering pain relief. So that's why I recommend to start answering questions from 8 to 20. Then go back to start from 1 to 7. For reading part A, at the start you have to locate and detect titles and subtitles in each text. Then locate the alarming information as much as you can. So as you see here, we have the main item or the main title, fractures, dislocations, and sprains. We have fractures, dislocations, and sprain in this text. You can locate like clinically fractures are either closed compound, like types of fractures, and same thing for dislocations, and go for sprain. For the next text, simple fracture of limbs, immediate management, then clinical assessment, then management. Here we have how to examine physical examination, and here we have tips or steps, then check whether blah blah blah. So you have to scan and detect titles and subtitles, then go for the uh, alarming information or important words or keywords. Then in this third text, C, drug therapy protocol, we have this drug, morphine, and we have two dosage for adults. But we have two types or up to three types of route of administration, intramuscular, subcutaneous, IV. Then in the last part, in text D, technique for plaster back slab for arm fractures, use same principle for leg fractures. Then we have 8 points. So you have to do these steps within 2 minutes only. So briefly, just to locate the main items and subtitles, then the important words or pertinent information. Then start answering question number 8 till the end, then go for question from first to 7 to locate the most fitting text for the given information or mentioned information, like matching. Question types in part B, we have 6 short extracts for 6 MCQs. And you have to finish each text within 2 minutes only. At the start, read the question prompt, then read the text, then detect the correct answer. So this is the question prompt, this is the text, and lastly, here we have the answers. So firstly, read the question prompt, then read the text, then detect the correct answer within 2 minutes at maximum. So you can skip this slide. Again, the provided answers could be a correct answer, contradicting answer, not mentioned at all, mentioned but the meaning is too specific or too generalized. So let's practice. Regarding the sequence, in this practice, at the start, you have 1 minute to read the text, then another minute to detect the correct answer. So are you ready? So let's start. Time's up. So this is what's your answer? Yes, the correct answer is C. Can delegate responsibility for the cupboard keys to another ward. As you see in this sentence, if necessary, the nurse in charge should arrange for the keys to be held in a neighboring ward or department by the nurse in charge there. So can delegate responsibility for the word for the cupboard keys for to another word. The next one. Are you ready? Time's up. Yes, the correct answer is A. Give a valid reason for conducting it. As you see here, the person consenting will need an explanation of the reasons for the postmortem examination and what it hopes to achieve, while allow all relatives the opportunity to decline it, not mention at all, only raise the subject after death has occurred, contradicting answer. As you see in this line, the first approach should be made as soon as it's apparent that a postmortem examination may be desirable, as there is no need to wait till or until the patient has died. Contradicting answer. So the correct answer is give a valid reason for contradicting it. The next one. Time's up. Yes, excellent. The correct answer is A, help maximize its efficiency. Actually, from this line till this point, we can clearly understand that these sentences are talking about uh, how to maximize the efficiency of the incineration, like increasing the incineration temperature. Question types in part C. In part C, we have two large texts, and in each text, we have within 7 up to 8 paragraphs. And for each text, you have to answer 8 multiple choice questions, consist of 4 option multiple choice questions. Two minutes each for each question. At the start, you have to read the question prompt to locate which paragraph or text you have to read. Then go back for the question prompt again to read carefully and find the correct answer. So again, you have to read the question prompt just to locate the paragraph. Then read the question prompt or read the text and the question prompt to find the correct answer. As you see in this slide, here we have 1, 2, 3, 4 paragraphs, and this is the start of this text, paragraph number 1, number 2, number 3, number 4, and we have next slide for 3 or up to 4 more paragraphs. Here we have this question number 7, number 8, number 9. And the next slide also we have 3 questions. In this question prompt, what point is made about the death of a female patient called Mary? So you will search for the first paragraph that talks about this patient, Mary. So as you see clearly here, we have this name, Mary, in this first paragraph. So I will search for the correct answer in this paragraph. Then, what's meant by the paraphrase effort substitution and highlighted and also underlined in this paragraph? By quoting Dixon Woods in the second paragraph. This is the second paragraph. In the next slide, so you have Mary, effort substitution, second paragraph, second paragraph. The same thing, correct answer, contradicted answer. not mentioned at all, and mentioned but the meaning is too specific or too generalized. So in the next slide, also we have question number 10. This is paragraph number 3, number 4, number 5, number 6, number 7. Question number 10, what point is made about checklists in the third paragraph? So you will search for the correct answer in the third paragraph. Question number 11, what problem is mentioned in the fourth paragraph? You have to search for the correct answer in this paragraph. The last question, we are talking about climate change. So you will search for the first time we have climate change. In this paragraph, climate change. Yes, Dr. Hala, yes. Regarding the listening and reading subtests, the content is the same for all healthcare professions. The same. Okay, so we can practice this first slide only. You have 6 minutes to find the correct answers for these 3 questions. So 2 minutes for each. Okay, so let's check your answers. Okay, let's compare your answers with the correct answers. Number 7A, CA. ABC, ACC, ACC, ABC, ACC, ADA, ACA, ACB, ACD, ACC. Okay. Okay, exist. Actually, regarding for part C in the reading subtest, the challenge here is the timing, not to find the correct answer. So with practice, and actually for this slide, it should be for 4 questions, not 3 questions, because we have 8 questions. So you have to try to practice to find the correct answer within 1.5 minutes instead of 2 minutes. So with practice, you'll be able to find the correct answer um, rapidly, and always you have to consider paraphrasing and normalization in the reading and listening subjects to find the correct answer. So you'll not find the same word, but you can find the paraphrased word or the same meaning in different words. So that's why you have to deal with the um, reading subtest in part C, especially in part C. It's very difficult in the same way for the listening subtest without pauses or gaps in the record. Okay, so this is the end of our session today. Do you have any question before we finish? Doctors, do you have a question? The next session will be for doctor-patient communication, which will be the speak subtest. Dr. Nader is asking, where can I practice reading? Okay, you can check our Telegram group now, and I will send you the post regarding all the needed OET material to practice. Okay, wait a minute. Post number 1, OET materials. Okay. Dr. Nader, you can review our Telegram group and you can find the post for OET materials, all the OET materials, and the first point, Jashan reading book for reading practice, and for listening, also Jashan book and Sam's OET listening book, which is my book. And for speaking materials, we have this drive link, and also for writing materials, also we have this drive link. Dr. Sarah, actually, we have no other materials for the reading subtest in the market. So actually, you can practice this book again in a second round, just to get better scores in the next practice. Thank you, doctors, for attending our session today. The next session will be on Tuesday. Tuesday, I think I have shared the timetable for the next sessions, and I can share it now again. So you can review the timetable for next sessions. We have the next session on Tuesday, in the same timing, or on 11 p.m. Cairo time. Thank you, doctors. Hope you the best and good night.